Good morning, and happy days to anyone that watches this and it's not the morning. I'm Jocelyn, pelvic floor physical therapist, and today I am talking or discussing, teaching you guys everything you need, or what every woman needs to know about urinary incontinence. So if you're on this live, please comment live. And if you come on the replay, comment replay. And if any questions come up, post them below in the comments. So let's dive into it. Hope everyone's doing well today. Before we get into the meat of it, let me just give you a summary. We're going to talk about the definition of urinary incontinence, what it means and how it affects your life, different types of incontinence, how they occur, how it's treated, and after that, we're going to talk about how having urinary leakage provides someone like me and some other providers invaluable insight should you also have a history or a present problem of recurrent low back pain, hip pain, things that just don't seem to go away and stay away. And then lastly, the impact it can have across decades in a woman's life, and why we need, as women, collectively, we need to stop laughing this off and saying, oh, this is normal after having kids, because it's feeding into the problem. So in the past several months, I have expanded my who I've been treating from mainly that 20 to 50 age group to upwards of into the hundredth decade. I hope I'm saying that right. And it has taught me so much. And, you know, if I have thought about putting collectively their especially my in 90s and 80s and even into the hundreds, their advice to women after I've treated them and after they've learned for the first time the things that I've taught them. I wish I might actually do it, put it in a book and give it to the world, because if they could go back and have this information and act on it, they would be in a much different position. So let's talk about on a spectrum, and then we'll dive into it. I had a 101-year-old patient, and she was at the scale of utmost health, no issues, didn't take medications, except had maybe, I think, a multivitamin or something, and something maybe for her thyroid. But she eventually tried bladder meds because she was getting up and going to the bathroom 8 to 10 plus times a night, and she was having a lot of pain with trying to empty her bladder. And her history was that she had 4 or so kids, and she had to have multiple bladder procedures. First one being a sling, and some of those procedures failed, leading to her having to get a third. And at no point was she taught about anything related to rehab or bladder retraining, pelvic floor relaxation, all of that stuff. Not taught any of that. And then even worse, she wasn't provided any guidance after these procedures. So she just went on to live her life as normal. And what the problem is with that is that if you do too much when the tissue's healing, it creates this inflammatory response around the area, and that inflammation can result in scarring, adhesions, and so on. So she had gone on to have a back surgery. She's had other things related around that bladder, that decade or decades around the bladder, and then ultimately tried bladder meds, didn't work. And there she was, going to the bathroom 8 plus times a night. This woman was 101 when I treated her, and she needs her sleep. We all need our sleep, and I'm going to dive into that later, but that's the problem. Is like she is this really healthy woman, and just not being able to get sleep at night can completely tip that scale for her. And she could fall, God forbid she falls. So that's what someone really healthy experienced. The second is on a more unhealthy level. This woman, young, I mean, she looked old, but she was in her 60s. And her issue started around having multiple children and not taking care taking care of herself, suffered with pretty significant urinary incontinence for years. And then it became so debilitating alongside back pain. She developed diabetes, different chronic diseases, and she got to the point where she didn't have the core strength she was so constipated and didn't have core strength to have efficient bowel movement. So repeated issues with bowel impaction, and also the bowels can affect the bladder. She had urgency and leakage, like urgency, always feeling she has to pee. And the driver there was constipation, but big issues related to not knowing or not dealing with some of the things that are related to initially incontinence. So the decline of her life from that point was really, really sad. And so that was a more significant case, but I've seen it, man. I've seen it. So I don't share this to freak anyone out. I share it because even the most healthy people can experience this, and it can really change the trajectory of their life. And all my women that I've treated in the past, even men, but this focus on women, they would say, I wish I would have known, and if I would have known, I would hope I would listen about this stuff, because it impacts everything. So let's dive into the chat today. Number one, just the basics about urinary incontinence. What's the definition? Well, urinary incontinence is unwanted urinary leakage that occurs anywhere but the toilet. So to name a few common but not normal examples would be leaking urine when you sneeze, when you cough, when you move quickly like a bend or turning, and then when you are jumping or running. You have three main types that big categories, three main types: stress urinary incontinence, urge urinary incontinence, and mixed urinary incontinence. Stress urinary incontinence is when you have a big increase in pressure within your body cavity and you leak. That would be leaking when you sneeze, when you exercise. Urge urinary incontinence is when you feel suddenly, oh my gosh, I have to go to the bathroom, and you just with that urge, when it's pretty significant, you'd leak right there. Or when you have triggers like water turning on, or turning on the light, grabbing your garage keys, or talking about peeing, where you can see yourself transitioning. Well, let me talk about next. Mixed urinary incontinence is a mixture of both. So what I was just about to say is where, a lot of women start with stress urinary incontinence around childbirth, and then they don't deal with it, and it slowly transitions into urge urinary incontinence. And where I could kind of see that point is when women start to feel urge, and then they got to get to the bathroom very quickly. So in this time interval starts to decrease and decrease and decrease to the point where as soon as they get the urge, they start to leak. The reason why this is important, you guys, is they're treated different. Like the way that I approach stress urinary incontinence, very different than your urge urinary incontinence. And then with mixed, we have to kind of see what is more the dominant feature in your picture and treat that first and then go from there. And sometimes we got to get creative. So what's the cause? Well, there's a spike in pressure within the bladder when it contracts. So you have a bladder muscle. I don't have my organs with me, but you have your bladder, and it has muscles, and we don't have control over them, but there's a spike in pressure within the bladder, and as it contracts. So it contracts because of either, physical movement of the bladder, or from an irritation, like let's say you have very acidic urine, or you're drinking a lot of caffeine, or you just have inflammation in that area. So it contracts. That's basically like suddenly pour a dam going through lots of water going, or maybe not a lot of water, going through a dam that isn't ready for it. So what happens is the door is either inadequate or isn't shut all the way, and so water, or in this case urine, leaks through. So where jostling or movement can create this is, when you bend or when you turn really quick, or let's say you didn't completely empty your bladder for whatever reason, or urine didn't fully get out of the tube that urine comes out, and you move that, or you get up and you wipe, and then when you get up you start to dribble. That's not uncommon for there just to be a little bit of urine that didn't escape out, and so you leak then. That's kind of related to the movement piece that I talked about. And then jumping is that jostling as well. So basically the dam that's supposed to stop the rushing of water or urine is inadequate. And that could be because your pelvic floor muscles are weak. It could be that the connective tissue that the muscles attach or are part of is disrupted from multiple vaginal deliveries or other reasons. Or there's other reasons, but let me just keep it simple because this isn't a deep dive on this, but above is too strong for what's below to block it. So what do we do to treat that? Well, I'm going to focus on the PT side because that's what I do. And first things first is conservatively, meaning you're not having surgery. Do not even, like women that go right to surgery, it's actually insanity to me. But what do? Well, we have to identify what kind of leakage you're having. Is it stress, or is it urge, or is it a mixed picture? And that drives our treatment approach. So if it's stress urinary incontinence, and depending on when it's occurring, we treat your movement impairments. Like oftentimes, well, at first, we do have to do a little bit of isolated, honed in on the pelvic floor, get some scar tissue out, make sure the urethra is moving well, support the urethra with what we can, make sure you're not doing things with your abdominals and your pelvic floor that you shouldn't be doing. And then we look at and we also look at the movements that you're doing where you're leaking. We look at your breathing when you do them. We look at your movement patterns, your control elsewhere, not just the pelvic floor. And it's super fun, and I love treating it. It's my favorite thing. I'm like Buddy the Elf. It's my favorite thing. It's so much fun. And then, urge urinary incontinence is pretty fun too. It's like a video game. We have to retrain your bladder to not contract with the triggers. So that is, we have to reprogram. So if you've ever had a puppy and you're trying to get the puppy to behave how you want it to behave, that is kind of like what we do. It's super challenging at first, but it's like character building at its finest. And it's amazing. You get your life back. Then mixed urinary incontinence is a combination of what I just described. So what does it mean to leak urine? Well, it means that there is a deficit or a weakness in your system where you're losing valuable pressure that you need for your body to function, or you are dishonoring your body by waiting 6 hours to go to the bathroom. As teachers, there's a lot of different meanings, but basically it means that there is a problem in the system and it needs to be addressed. So think of when you have a hole in your tire and air escapes out. That's kind of like leaking urine. There's urine leaking out. Your body's your tire. So why did that happen? Was there a nail? Was it temperature? Was it the way you're driving? Is it an alignment issue? All of those things can play a role. Now the result, the consequence of continuing to let this happen is that two things can happen. The hole, and even though it's not necessarily a hole, but since we're using the tire analogy, I'm using the hole, it gets worse and worse and worse. Or you start to compensate, so you move differently, you do things differently, or you empty your bladder, you get into habits which leads to that mixed presentation I was telling you about. And you compensate and other areas are affected. So a lot of times it's people's hips, their low backs, their feet, their neck. It's insane, but it's also very treatable. And the result is you might create a really big problem that is hard to treat, or it takes longer to treat. Doesn't mean you're not treatable, it just takes longer to treat. You might not be able to do your favorite activities, so that means you're not with your best friends, you're not with your community. You might not be able to, you might have to think, like plan your day out around where the toilets are. You might have to decide where you're going or not going because of your access to bathrooms. I've heard it all. You might avoid being intimate with your partner because of your people have told me I feel like I smell like urine all the time. And I'm telling you, that is not a fun or a very empowering feeling. So moving on, how leaking urine provides invaluable insight if you've also experienced issues like back pain, hip pain, neck pain. Well, this tells me that if you're leaking urine and you have these issues, you're compensating out to try to reduce how much you're leaking. And so if you're not stable in your urethra and your pelvic floor, or that's not doing its job, but you don't want to leak, you're going to move differently, and that could put forces on your hips and your back. You can dominate by holding your breath or arching your back and using your back muscles because other areas are weak, like the deep core. And that's why your back hurts, guys. In manipulations and physical therapy interventions that don't address this underlying issue, it's not going to last. It might go away for a little bit, but if you're hiding it through like always emptying your bladder, you're actually creating a whole new issue with transferring stress urinary incontinence into urge. It gives me huge insight on core function. It tells me, okay, your deep core is not functioning well, so that's where we have to go next. Last, the impact it can have across the decades in a woman's life, and why we need, as a collective unit or a collective group, we need to stop laughing it off and saying, oh, it's just normal. Because number one, even if you're not aware of it, you're insecure, and laughing it off is just saying, I'm actually insecure about this, and I don't want to deal with it. But here's the thing, it doesn't go away fully, as I just mentioned. It presents elsewhere. Like if you have a pressure mismanagement in your pelvic floor where you're leaking urine, then it's going to manifest somewhere, whether that be pain, whether that be just the feeling that you need to stretch, whether it's plateauing. It does. Trust me, it does. I've seen it. I've seen how it manifests. It's not going away. And maybe it does a little bit, but what typically happens is it'll fluctuate with hormonal fluctuations. So it'll come back with a vengeance towards that perimenopausal, menopausal time. We need to stop laughing at it because it's basically your body, forgive me, BITCH, slapping you and saying, listen to me and take care of me. So you got to listen to it. And I think it's such a gift that we have these systems within our body to communicate with us. So listen to it. I mean, if you've already listened to it and you've gone through treatment, that's one thing. But if you're one of those people that are continuously ignoring it and saying whatever, not okay. Another reason. It's the number 2 reason for nursing home, for people as they age to be transferred into a nursing home, because it's just such a problem down the road. And it's not, it's coupled with so many things, and that's the thing, like, it's never just urinary incontinence, it's pain, it's all these different things. So You don't want that. I mean, I've been in and out of many as a PT, and I never want to be in one, and I don't want to put my parents in one. So Mom, if you watch this, don't you dare be incontinent when you're older. Next, consciously or subconsciously, guys, it's going to impact what you wear, whether or not you choose to go somewhere, like I mentioned before, and what you choose in your activities. It can compensate, or it impacts the way you move. Like I said, it compensate other ways, whether you're aware of it or not. And then, I mean, it often starts as an isolated unit. Oh, I just leak whenever I sneeze or cough. And then you start, a lot of people aren't aware of it, but then they, if this happens, like during a workout, they'll just go and empty their bladder before a workout. But then that's a problem, because then it triggers, like, the bladder is like, oh, I should be emptying whenever I have just this amount of urine in my system. So then it slowly snowballs into a bigger thing. Then if it snowballs into a thing where it's impacting your sleep, when you're getting up, going to the bathroom, we know in the healthcare that if you're getting poor sleep, your levels of cortisol, which is stress hormone, goes up. It impacts your overall heart health, your metabolic health, hormones. I mean, if you're not sleeping, you're not able to train, or you're not eating well, or you're eating more because you're up longer. Weight gain, decreased self-esteem. Let's see what else. You're depressed or anxious about the whole situation. It impacts how you're approaching your workday, approaching just your day and your workouts, and it ultimately can impact your relationships. And it starts with something so little, and I wouldn't be surprised if many of you aren't able to. I mean, I know it. Like, it takes time for people to admit, like, oh my gosh, it does impact my life, and I just didn't want to admit it. But here's the thing, it's scary to talk to people about it, but understand that most people are going to be very relieved that you brought it up, like if you're talking with your friends. And if they're not, they're insecure, probably. Or they're just not really paying attention to you. Or they're just someone, that maybe you shouldn't share that information with. You should share someone that has earned the right to hear that from you. If you feel uncomfortable from telling this to your healthcare provider, or they brush it off, or they go right to medications, I recommend going to a different healthcare provider. If you have gone to a PT and they haven't addressed, like, movement, they haven't done a deep dive and an investigation, they haven't empowered you to be part of this journey, I would have a conversation and consider seeing someone else. I mean, this is so impactful. You have to take it seriously. Now, I just talked about I would say surface level. This goes a lot deeper, but it's a lot more complex, and I don't know if you need to know the complexity of those issues. You just need to know it's important, what it is, how it, in the big picture, impacts your health and your life, and the benefit. Like, if you do get it treated, man, I mean, you're gonna know your body so much better. If you address the underlying cause, if we go back to the deep core, and it's not something like a neuro condition or a congenital thing. I mean, even if it is, you still benefit from addressing it, but it's a little bit different approach than I'm talking today. I mean, you are going to be like, oh my gosh, I'm moving. I have so much more control over my body. I can't even believe that I was moving any other way. So, if that's you and you are on the fence, I encourage you to go for it. Get the pelvic floor mobility, guys. The pelvic floor mobility, and then, just your habits are huge. So if you know anyone that could benefit from this, please, please, please tell them about the group. Bring them in. The whole purpose of this group is to provide education that is, expert-based, it's science-based, it's research-based, but also apply it to, like, how it impacts your life. These are the conversations that people are not readily having on the streets. These are conversations that, your physical therapist, if you go to PT and you have for like your hip or your knee, they may not ever bring this up. We're making way, we are progressing, but it's going to be slow. So bring them in. I mean, it takes a long time for people to be ready to treat this, but if they see this and get treatment faster or start to change quicker, the impact it can have on the rest of their life is just so huge. So my ask for you, I'm going to continue to provide this knowledge and this info, but I ask for you to spread the word. Bring in your sister, bring in your mom, bring in your friends, but bring them in if they value a healthy, active lifestyle. This group is not a group that doesn't care about living living a whole life and living a healthy life and getting into activity. If you're a couch potato that doesn't care and just wants the world to happen to you, or you just want things handed to you, this group isn't for you. There are other groups for that. But if you know people, that you could bring in that value this stuff, that value empowerment and taking life by taking ownership of their life, then bring them in. Thank you guys so much. I will see you next Tuesday on Real Talk with the Vagina Doc, and I will release the schedule for that soon. If there's anything that you want to listen to specifically or for me to talk about specifically, please comment below or send me a message, and I will be sure to make that happen. Thank you again for listening. If you didn't already, comment live if you were live, or comment replay if you watch this on a replay. I really appreciate it. People see it that are in the group, and that's really important.